Let's speak to Niall Dickson, Chief Executive of the NHS Confederation. They represent NHS organisations, including hospitals and GPs. Good morning to you.
Good morning.
So, working with private hospitals, now, as I understand it, the deal means that they are hired out at cost from the private industry. Is that right?
That's right. So there won't be any profit made as a result of this. And I think it is. I don't think really anybody cares. They don't care in normal times, most people, and certainly now, nobody cares who owns what. The answer is every bit of our health and care system that we can deploy to tackle the virus has to be good. So that brings on 1,200 ventilators, more access to the kind of respiratory care that is needed, all sorts of other things that the independent sector can do, and it brings on a whole lot more beds as well.
But it's still going to come at a cost. Money has to be found from somewhere. What will the total cost be? Do we know?
I don't know the particular. Well, it depends how long it goes on for, I suppose, is the answer. But the government's made it clear that it will provide whatever is required in order for for us all to be able to tackle this. And we absolutely want to see on the NHS front line that money is coming through as it's been promised.
Yeah, whatever it takes is the refrain that we keep hearing. We heard it once again from Nick Gibb there. What about personal protection equipment? Now, officially, we keep being told this is fine, it's sorted, there's enough of it. But repeatedly, people on the front line saying completely inadequate, not enough, and our health workers really are at risk.
Yeah, we're getting exactly the same. So we've been monitoring this. We've certainly had quite a lot of concern from GP land over the last few days. There are also concerns in some parts of the system. So to put this in context, I would say it is inevitable that in a service the size of the NHS, you'll probably always be getting some of these messages, but we've been getting too many of them. I think the centre has recognised that it wasn't working. They say they put in, and I believe them, they put in new measures, so they're working around the clock to make sure the trucks are on the ground delivering what's needed. They're talking about literally 2.6 million face masks and 10,000 sanitisers delivered on Thursday, that every GP practice has had some kit that's been sent to it. So there's a lot going on.
We've had weeks to get this right.
Well, it's a good question. I think the answer is that they had the stockpiles. What they had not got was a system that was able to cope with a huge number of requests at one time. And so what they've had to do is they've set up a hotline that takes orders 24 hours a day. They've got the sort of the system around the stockpiles. The good news, if there is any good news at the moment, is that we have got very significant stockpiles, partly because of the way we run our healthcare system. We had a preparation for a flu pandemic, so we've got the huge stockpiles for that. And then for Brexit no deal, we added to that, and not all of those have been sent out into the system. So there's a lot of material there for now, and therefore the message from the centre is there is the kit there, but it is taking. They clearly haven't managed over the last sort of 10 days to get this up and running in quite the way that it should have been, and that's caused some real concern on the ground. I think what we have to do is look over the next 24, 48 hours, and we should be starting to receive very different messages from the front line.
It really does need to be sorted, but I think we're in agreement on that. Thank you. Niall Dickson, Chief Executive of the NHS Confed.